It's already tough enough being a teenager with all of the social pressures and the stress of homework and extracurricular activities. On top of that, some struggle with a skin condition that can carry an additional burden. Many people think that atopic dermatitis, also called AD or eczema, is just a skin condition with some itchy patches on the skin. But it is more than skin deep, and it can be a serious and debilitating condition that affects many teens in the U.S. Here to talk about atopic dermatitis are Dr. Sugarman and patient Jake, a teenager living with severe atopic dermatitis. Doctor, can you describe the symptoms of moderate to severe atopic dermatitis and how this impacts adolescents?
Atopic dermatitis, which is the most common form of eczema, is a chronic inflammatory skin disease that looks like red, scaly, itchy, dry patches on the skin. In some of the more severely affected patients, it can cover a really significant percentage of the body surface. Half the body surface or more can be affected. And these patients often have relentless itching, which is a real burden for these patients. The immune system in atopic dermatitis is very sensitive, and there are probably hundreds of thousands of adolescents out there in the United States that suffer from atopic dermatitis.
So for these teens with moderate to severe atopic dermatitis, what can they do to treat it?
Well, we have a lot of treatment options. First, I would suggest that patients talk to their doctors, talk to their eczema specialist to find out exactly the right treatment program for them. I'm here today to raise awareness for atopic dermatitis on behalf of Regeneron and Sanofi. If a particular patient winds up at their doctor and they have mild disease, they might just wind up getting advice on really good skincare. If they have more moderate disease, they may wind up getting a steroid cream or a non-steroid anti-inflammatory cream. But for the patients with more severe disease, often we're going to be talking about oral treatments, and there are now even injectable treatments for atopic dermatitis.
Jake, you've struggled with severe atopic dermatitis for years. Tell us about your story and what you want every teen to know about.
So I was diagnosed with atopic dermatitis when I was only 6 months old, so I've been living with it for the last 17 years. And in fact, some of my earliest memories involve me walking around SeaWorld and just scratching my hands and being distracted from the quality of life around me. And what I want every teen to know with this condition is that, talk to your doctor, do your research, take charge of your own health, be your own health advocate. And there's many resources out there to help you, such as optionforad.com and other websites.
Jake, what advice do you have for teens struggling with this skin disease?
Well, it is hard to talk about. It's difficult to go to your doctor and say that you're struggling with this and that you need help. And there's actually a discussion guide on optionforad.com to help with that. And I think that's one of the most important things, is being able to talk to your doctor and seek the help that you need.
And finally, doctor, where can our viewers at home go to learn more information?
Well, like Jake said, I would start with your doctor. So talk to your eczema specialist, talk to your primary care provider. Online, the American Academy of Dermatology has really, really great literature on their website, and as Jake mentioned, optionforad.com also has a lot of information. It's hard enough being a teenager, but being a teenager with the burden of moderate or severe eczema can be very difficult. It affects the way you dress, it affects your willingness to go to the beach with your friends or go to a party, because you don't want to be stigmatized if you've got weeping open skin and you're itchy.
Gentlemen, thank you for being with us.
Thank you for having us.
Thank you for having us.